Hello, everyone. For this discussion, I've chosen to focus on generalized anxiety disorder, or GAD for short. This disorder is characterized by excessive and uncontrollable worry that occurs more days than not, often accompanied by physical symptoms such as restlessness, difficulty concentrating, and sleep disturbances. When considering how best to visualize and treat generalized anxiety disorder, we have two options. The traditional categorical model, where someone either meets the DSM 5 criteria or they don't, and the dimensional model, which views anxiety symptoms along a continuum. As a psychologist, I would favor the dimensional model for treating generalized anxiety disorder. One reason is that anxiety symptoms rarely exist in neat, clear-cut categories. An example of this would be many people who do not meet the full DSM criteria for generalized anxiety disorder can still experience significant distress and impairment. Under a category model, those individuals may not receive treatment, even though their functioning is clearly impacted. The dimensional model avoids this issue by allowing psychologists to assess symptom severity along a spectrum from mild to severe. Research also shows that anxiety disorders, including generalized anxiety disorder, often overlap with one another and with other conditions like depression. The dimensional model captures this overlap better since it does not impose rigid boundaries between disorders. This provides a more accurate picture of the client's overall level of distress and comorbidity. From a treatment standpoint, using a dimensional approach allows for more personalized care instead of just saying, yes, you have generalized anxiety disorder, or no, you don't. We can measure progress by tracking reductions in symptom severity over time. This is especially important because treatment goals often focus on reducing, not eliminating, symptoms. An example of this would be if someone's worry intensity decreases from severe to mild, that would be meaningful progress, even if they still technically meet some diagnostic criteria. While categorical diagnoses are still necessary for things like insurance reimbursement or research standardization, I still believe dimensional model gives us a richer clinical information. They recognize the reality that anxiety exists on a continuum, and they help us avoid leaving people untreated simply because they don't cross an arbitrary threshold. In summary, for a generalized anxiety disorder, I would use a dimensional model because it provides greater flexibility, reflects the true nature of anxiety symptoms, and ultimately supports better individualized treatment outcomes. Thank you so much.